Hello, it's Dr. Haddad, the Chief of Staff of Water Health. Hope you're doing well and staying safe. So far, so good at the hospital. We have not had to slow down any of our clinical operations. We have ramped up back in the summer to catch up on the backlog that was created in the first wave of COVID-19, and so far we're maintaining our operations at 100%. We did put a dent in the wait list, albeit we still have ways to go. Having said this, we are keeping a close eye on what's happening around us. Definitely, the second wave is in Ontario, albeit not as bad in Lambton County so far. We do have many plans to deal with the second wave if we are affected by it locally, especially at the hospital level. In the meantime, I'd like to talk about the loss of an important member of our care team at the hospital, and those members are you as a community and family members. I've heard a lot about patients who are quite ill at the hospital missing the support of their families. We've heard a lot from families who wish to spend more time with their loved ones at the hospital, and it is quite sad and almost tragic that we've lost this very important member of the team. We've always enjoyed having families around, both to get more information about the patients and to get their help with patient care and update them at the same time about the therapeutic plans. Unfortunately, given the pandemic, we had to implement strict measures to protect the rest of the patients and staff as well from the circulating virus in the community. Currently, the restrictions are still fairly restrictive. Having said this, we did loosen things up a bit during the summertime. I hope we don't have to clamp down again during the second wave, as our numbers are still under control in the hospital here and locally in the county as well. We will see how we do over the next few months. And ideally, we would love to have more visitors, more family members, more caregivers to help us out with the care of their patients and loved ones, with our patients and loved ones. But this will be very dependent on what happens locally in terms of the second wave of COVID-19. Even though the numbers do look worrisome in the province and the country, there is still hope. And the hope basically is that at least we seem to have a vaccine in the horizon. There's two good potential vaccines, one from Pfizer, one from Moderna. And rumors has it that hopefully we'll be able to start having access to it sometime in January or February. In the meantime, our goal as a community is to do our best to follow public health measures to reduce the risk of any of us catching COVID-19, reduce the circulating virus in the community as we wait to get an effective vaccine distributed. For now, we will continue to do our best at the hospital to maintain our services, and if there's any reduction in any services because of extra pressures, we will definitely update both the healthcare providers and our patients and their loved ones. In the meantime, please stay safe, and let us know if you have any questions. Thank you.